Hello and a very good day to you all. This video is particularly for women who are menopaused, perimenopaused or experiencing menopausal symptoms. Now, what is menopause? Menopause is defined as 12 months without periods and the symptoms also that come with menopause, such as hot flushes, mood swings, dry skin. I'll come back to that. Now, how are you certain if you're menopause? So, well, the first thing is to be able to do a diagnosis, and that will be history, patient history, and also a blood test, where in the blood we'll be able to see if you're still producing hormones or not. That is particularly important. For example, if you have a hysterectomy, you won't necessarily know if you're still producing hormones or not. So, history and blood test. There's several periods actually before menopause. So there's from 33 years old what we call premenopausal, where sometimes there can be no symptoms or simply just variations in the cycle. Then from 47 it's perimenopausal period, where the periods can start to become longer, shorter, or lighter periods, and beginning of symptoms such as hot flushes, dry skin, mood swings, dry intimate zones, and then finally come up to menopause where the periods stop. Now, how do you treat menopause? Now, the main treatment is obviously hormones. HRT, hormone replacement therapy. But it is important to be able to do that in a secure and safe way. Now, what is important is to get patient history, have a look if you've had any cancers. Obviously, if you have, depending on what cancers they are, hormones will not be for you. We'll need to get family history to see if there've been any women's cancer in women who are close, mother, sister, so on. And after, we'll need also an up-to-date mammogram, which will help us see how the breast tissues exclude any disease that could be underlying and that could be stimulated by hormones. And finally, a pelvic ultrasound scan to be able to look at the ovaries, the womb, the endometrium, see if there's any cysts or polyps, and so on. Now, I know there's a big debate between HRT and cancer. This is historically due to a study that came out beginning of the millennium, which is called Women's Health Initiative, where there was a correlation that was seen between cancer and HRT. I'm not going to debate on all that today, but just to say that we found out many years later, obviously now, that hormones can be given in a secure way. We need to know what types of hormones. Obviously, if you have synthetic hormones, the risk could be a little bit higher, especially with breast cancer. So is there a combination between estrogen and progesterone? What we know now is that if we come with a dose that is adapted, fairly low, and that you have regular checkups, be every 6 to 12 months, then we're able to reduce to a maximum all these risks. And obviously, if there's any positive family history, we're not going to introduce that. So there we are. What are the forms of treatment? Well, HRT, there's several forms. You can have them in forms of patches, creams, of tablets, and what we're going to have a look, what's really important is that this treatment is tailor-made according to your needs. In the treatments, there's plant treatment, there's hormonal treatment, and there's bioidentical treatment, which I speak about in another video. From there, we're going to be able to introduce this and reduce maximum the symptoms that you have. So, quick short summary. I hope this video has brought interest to you. If you have any comments, do leave them below in the chat. If you'd like to, definitely put us a little like. If you think some friends around could benefit from the video, do share it. And myself and the whole team here at Clinique Suisse are at your disposal should you need us. And we look forward to seeing you very soon. And have a great day. Bye.